Very good evening to everybody, and thank you all for being here on time. I welcome you all to another session of Sphere India COVID-19 Academy. Sphere India COVID-19 Academy is a joint capacity building initiative of WHO, UNICEF, and HCL Foundation. So today, the Academy brings a very interesting panel discussion in partnership with Lee Rhythm. So I would like to tell the audience about Lee Rhythm a bit. So Lee Rhythm is a certified trust constantly striving for the promotion and development of socio-cultural activities in different parts of the country. To develop and demonstrate the soft skills, Lee Rhythm provides the platform to showcase the talent of underprivileged children by organizing and presenting best-in-class musical events across the country. So the discussion, the today's Sphere India COVID-19 Academy in partnership with Lee Rhythm brings a very special panel discussion, which is role of yoga and music as therapy in maintaining physical and mental health to combat COVID-19 lockdown situation. As we are aware that India's public landscape has transformed dramatically over the last couple of months, with the most prolonged lockdown that the present generation can remember. Declared on March 24, 2020, the lockdown ensured that hundreds of millions of people were effectively confined to home. While this may have been a very effective way of helping to curb the spread of the virus, novel coronavirus, it has not perhaps been conducive to emotional and mental health of some groups. So today's discussion will focus on tips for children and adolescents and parents to manage stress and depression during this lockdown, have a constructive engagement to maintain physical and mental life balance, some COVID-19 precaution and immunity development tips, and lastly, the role of yoga and music in healing mind and body. To take forward the discussion, we have a very eminent panelist with us today. So our first panelist is Dr. Kunjhari Medhi. He is the speaker has more than 18 years of experience as a pediatrician and oncologist. At present, he's working as a director oncology and senior consultant, medical oncologist at Batra Hospital and Medical Research. Very welcome to you, sir, in this discussion. We have Dr. Palas Ghosh. He is a public health expert and eminent child specialist with more than 25 years of experience in this particular domain. At present, he is associated with the Medical College, West Bengal. Welcome to you, sir. We have Dr. Kalyashish Das. He is the motivational speaker in the public health expert and also public health expert. Eminent child specialists, psychotherapists, nutritionists, and advanced practitioners at neuro-linguistic program. He takes special interest of body and mind of the children and young people. That's his area of expertise. I welcome you, sir, in this discussion. We have Mr. Raja Paul. He's Associate Vice President of ClearNet. His leading healthcare profession, having more than 20 years of experience. As present, he's associated with US Invested Healthcare Technology, a company that is dedicated to dissemination of knowledge from super specialists across the globe, including Mayo Clinic, John Hopkins, Ottawa University, and more. I welcome you, sir. Looking forward to hear from you. We have Sri Anirudh Chaudhary, who is Senior Faculty, Rhythm School of Music, an eminent panelist and a music professional, faculty, music director, and composer. With more than 25 years of experience, he has performed in different parts of the globe and won many awards. Very welcome to you, sir. We have Mr. Amaresh Chakravarti. He is Senior Faculty, Rhythm School of Music, and he is also a music professional, motivator, faculty with more than 25 years of work experience. Prior to this, he has also worked with senior faculty of different colleges in under Delhi University. I welcome you, sir. And today we have a moderator for this entire discussion, Dr. Ilya Zafar. She is advisor, Sphere India. Ilya has more than 17 years of experience in humanitarian and development sector including many international missions. She has authored several academic papers on disaster management and gender in emergencies with a focus on women and children. She is a certified life coach as well, and she has worked with CARE International, Federation of Red Cross, Red Crescent Societies, South Asia and India delegation, and UNDP. She is currently also serving as Chief of Program at Save Life Foundation. So, a very warm welcome to everyone in this panel discussion today. And with this, I would like to hand it over to Ilya to take forward the discussion. Over to you, Ilya.
Thank you very much, Navila. And good evening, all of you, all the audience and the panelists. It gives me really great pleasure to be a part of this interesting discussion. And I'm looking forward to listen to all these eminent panelists that we have today. So as you all know, in the world which is dominated, and especially if you're talking of India, we listen about so many disasters, conflicts, epidemics. So obviously, these lead to a lot of trauma, and there is a need that such trauma on individuals and communities be dealt with in a very effective manner. One of the techniques to deal with stress and trauma is yoga and, of course, the use of music therapy. Not many humanitarian agencies use it, and therefore it's an opportunity for us to learn with this through this group how we can look at mental as well as physical health post disasters, and even during disasters, how do we deal with it. So to understand more about the issue, I would like to first go to our panelist, Dr. Kunjahari Mehdi. So, sir, in view of the situation of lockdown due to COVID that's happened, many people, the lives have completely changed, and therefore there has been impact on physical and mental health. So, if you could just help us understand what kind of impact takes place on mental and physical health, especially in COVID times, what has happened? What are some of the things that we need to focus on to maintain good physical and mental health of the people? So looking forward to hear on this.
Yeah, thank you for giving me the opportunity to speak on the topic. Let's discuss about what is actually coronavirus. This is a coronavirus pandemic, and this is the very unprecedented event, and we should know briefly what is the virus, why everybody is afraid of coronavirus all over the world. Coronavirus is a member of the coronavirus family. The main important point is there are protein spike in the virus, and that is those spikes proteins are responsible for attaching with the body's respiratory cells. So the virus is the RNA virus that it cannot multiply itself. That's why it uses the body's machinery, cellular machinery, to multiply. So once it entered into the body, it attaches with the respiratory cells. Then it uses the body's cells to multiply, and it spreads. So this is a viral infection, and once it goes inside the body, when it multiply, it spreads to uh, exterior part. That means through the aerosols when it sneezes or cough, and when it speaks, individual speaks, then the aerosol contains the viral particle, virus, and it spreads. And inside, in the body's immune, if the body's immune system is good immunological resistance, then this virus cannot give rise to a lot of symptoms, or the harm is less. But if immunocompromised, or there is some other problem in the body because of diabetes, because of comorbidities, because of asthmatic problem, because of kidney problem, because of cancer, if body's immune system is low, immunocompromised, then the harm is more, and it leads to a lot of problem in the body. So briefly, this is the disease. This is a pandemic, and this is spread globally. the main problem of this type of pandemic is that there is no definite treatment of this viral disease, and vaccine is yet to come. So we do not have definitive treatment for this viral infection. Only point I would like to make, how can we prevent? The main prevention, the preventive measures of this viral infection is by maintaining social distancing, by using mask, and usually we should prevent those uh, how the virus spread. So the virus spread by the fumite. Fumite means wherever the viral, the aerosol placed, aerosol falls in the surface, either in a body, either in a clothes or the objects, whatever touches, and the surfaces on the table or glasses or door handle, wherever all those objects are touched by the individual, infected individual, and by that way the virus is spread to the other individual. One is direct spread by aerosol, by coughing, by sneezing, by speaking, and second is by the means of fumite transmission. So only way to prevent this spread is to maintaining all those measures which are approved by, which are in the ICMR guideline or WHO guideline or prescribed by Government of India. So only we can prevent it, and second is we can increase our immunity. So by that increasing immunity, immune system, if body's immune system is good, then this viral infection can be handled properly. So this is briefly about the coronavirus and the infection. Now, what are the impacts of this pandemic? Nobody knows till when this viral infection, this pandemic will be there. Nobody knows when the vaccine will come, when we will get herd immunity, we will get proper immunity against this virus, and whenever we will get proper treatment, definitive treatment, nobody knows. But if we extrapolate the experience of the pandemics as a whole, we know that this type of pandemics have got impact on health, both physical and mental health. Second is, most importantly, in the economy. Because of lockdown, because of restriction of mobility, restriction of business, there is no outgoing activity. All the business places are closed. So because of that, there is a lot of effect on the economy. And third is the impact on the mental health mostly. And this comes in the later phase of the pandemic. So first is the impact on physical health. What is the impact of physical health? Number one, because of infection, because of the viral infection, if somebody is infected and there is symptoms and there is disease as a whole, and patient needs hospitalization and treatment, and there is chances of life-threatening complication also. So as such, these are the physical impact of the coronavirus as a whole. Second is, because of this pandemic, the chronic infection and non-infectious conditions like diabetes, cancer, kidney disease, respiratory illness, heart disease, all these problems are usually remain suppressed because of the pandemic, because of the fear of the infection, and people are mostly interested on the about the treatment of the coronavirus infection. So the other infections and the other diseases, non-infectious diseases like other infections, tuberculosis, malaria, all these infections remain suppressed or untreated, and the other non-infectious diseases also. So in the later part of the pandemics, once the acute effect is under control, then these diseases also will flare up, and this will also may come out as a epidemic of the different diseases. So these are the health impact. Second is there is anxiety amongst the all the people. What will happen when it will be cured? It will be over when the lockdown will over, when this containment concept will go. So this type of problem is usually there in the society. Everybody is anxious to know, and everybody is anxious about their future, about their studies, when the school will open, when the colleges will open, when the businesses will open, when the shops will open. So about all these activities, people are usually anxious. So this leads to a lot of problem of in a mental health aspect. The second is important impact is in economy. As we all know, economy is badly hit by the pandemic. All the measures to prevent the infection, like lockdown and other restriction in activity in businesses. So this suppress in this decline in economy will adversely affect into the health and mental health as well, because of lot of problem in because of income is going down, and many people will lost job. Already somebody has lost job. So all these effect will adversely ultimately affect in the mental health. So in the third phase of this pandemic, usually the major impact is in the mental health. Many people will have depression, many people will have neurosis, psychosis, of mental health issues will be there, and this usually comes in part of this pandemic, because now people are all most of the people are interested and busy with managing the current infection and the associated problem, and in due course of time, when this acute problem will be over, then these mental health issues will come in later part of the life, later part of this pandemic. So now this is the ideal time to address this issue. So if we know now how to prevent this stressful condition, how to prevent this depression or mental health issues, mental health problem, so at least we can have some effective measures. We can take some effective measures to prevent this dangerous situation. Like usually in pandemic, it happens, the number of suicides increases, number of
So thank
mostly
you,
depressive
Dr.
illness
Mehdi.
increases.
If
Yes.
I could request you to, because you very rightly said that there is a lot of uncertainty right now. People don't know what's happening. There is anxiety all over. There are issues of mental health. So if you had to give one recommendation of what should people do to address the mental health issues, do you have anything for the audience? Just if one sentence you could do that.
In it, I would like to say one sentence about the physical health, one sentence about the mental health.
Okay.
For the physical health, as I have mentioned, we don't have treatment, definitive treatment. We don't have definitive vaccine against this viral infection. So we have to increase our immunity. To increase the immune system of the immunity of the body, we need to have good food, nutrition, good nutrition, all the vitamins, required vitamins, minerals like zinc, vitamin C, all these vitamin D, all these vitamins and mineral supplements should be adequate. Next, we should have good sleep, at least 7-8 hours sleep, so that our body's immune system can function well. And third is we should give lot of importance in the to improve the improve the diet, like increase intake of water, warm water, and the food should be nutritious, and for the mental illness, to increase the mental status and to prevent the mental illness, mental stress, first thing, spiritually, we should accept the thing. That means we should allow to let go. This attitude should, everybody should acquire this concept of let go. That means to allow the let go, we should accept the thing that this is the situation. We do not have control on this. So we have to manage it. Since we do not have control on this, so this will subside in some day. It will take some time. After some time, it will automatically go. It will come to a normal state, but it will take time. So during this time, we should have patience. We should understand. Along with that, we should practice some yoga, meditation, and pranayam. All these time-tested, ancient activities and methods will release our stress, so that in later part of the life, later part of the pandemics, when the major impact will come, then we'll be able to cope with the situation.
Right. Yeah. Thank you very much, Dr. Mehdi. And you started with how coronavirus impacts us, a good understanding of that, and then going gradually on the physical and mental impact. I'm sure the audience would really have benefited. Since you did touch upon the impact on different age groups, on children, on elderly, on adults, on all groups, and how it impacts, I think it is very important. And I can see some of the audience also, we have children. So it's important to understand how does such a situation, when there is lockdown, children all around used to be, what was their routine? They used to go to school, they used to go outdoors to play. There was their own routine that used to be there. And now suddenly everything has changed. They definitely are, there are elements of anxiety that they are facing. They are struggling to understand why this is happening. And I think one of the tips that you gave, that there should be acceptance, is important to understand that there are things beyond our control. It may take some time for this to get over, but till then we have to maybe practice some of the exercises, some of the good sleep tips that you gave. I think that will really help. So going forward, since we have Dr. Palash with us, who has a specialization on children, Dr. Palash, I would like to understand from you that what is how does such a situation impact children specifically, and then what can parents, what can the school authorities, school systems, or any other people who interact with children, what can they do to ensure good mental and physical health of the children? Dr. Palash, over to you.
Hello, can you hear me?
Yes, sir.
I would like to thanks to the organizing committee to arrange such a good discussion at this pandemic situation. There are a lot of changes at this pandemic situation in children's mind and behavior. Those are experiencing right now. There are disruption of several normal activities of children, like sudden split off from their friends, not being able to go to playground, schools, parks, etc. All the parents during this time should spend a valuable time with their children. During this time, children may get easily bored. To cut down their boredom, they may engage in indoor games. Parents also make their learning fun by giving them puzzle to solve. They can teach them for creative activities like making crafts, etc. Encouraging them to pick up a hobby like playing guitar, drawing, dancing, playing violin, playing tabla. They can also make them to do stretching exercise and yoga. The parents should know the mental status of their children. They can also do with their children to give some household activities to keep them engaged. I want to say that it is not very advisable to provide children with a lot of reports, message related to this pandemic. But however, it is important to give them correct information as to what is happening around the whole world, so that they do not remain confused, as this may increase their anxiety. Parents should avoid being judgmental when they express their feelings. This can increase their fear and anxiety. Instead, make them understand that the things will be better if we take proper care ourselves. Do not get irritated with them. Physical distancing is one of the most important preventive measures. As they are declining or not able to meet with their friends, they feel distress. To relieve them, the parents may arrange to talk to their friends, cousins, and loved ones by calling up them or through video calls. Parents can also involve them with some fun activities which they can do with their friends by staying connected virtually. It is boost up their mental health as well as physical health also. Regarding physical health, we should look after for their good food, nutritious food. Ensure that they get into habit of washing their hands frequently, cover their mouth and nose with bent elbow when they are sneeze or cough. Eat food and ensure their child gets good sleep. It is a very important time that parents can spare more valuable and sweet time with their children, especially what can be very rare for their kids during normal days, because nowadays both of parents of many children is working. So in this situation, I would suggest to all parents to spend their valuable time with their children and make them secured and spend their whole time and valuable time with fun. Thank you.
Thank you very much, Dr. Palash, for very specific recommendations on what parents can do, what schools should do, and how we can engage with children with correct information, not overloading with information about pandemic, but definitely making them understand what's happening around the world, what they should do, also engaging in various fun activities, games, so that they are able to deal with mental stress. Uh, Now, another group that's very important for us is youth. And they are also, that's one group again, which is mostly going out, and they have, their friend circle, their college, some are into working. They've also been badly impacted. And to understand how the current pandemic situation has impacted the mental and physical health of youth, of everyone actually, but more specifically about youth, if I could request Dr. Kalyanashish Das to shed some light on that and also tell us what can be done for these different groups to heal their body and mind. Dr. Das, over to you, please.
Yeah. Thank you very much. Thank you for giving this opportunity of speaking and sharing with you all my views. As far as youth is concerned, because we know that the youth is full of energy, and the current situation is restricting the energy within the four walls of these of their houses, and also creating a lot of anxiety. We know that a lot of issues are coming out as far as the domestic violence is concerned. There are a lot of NGOs who are working towards this increased domestic violence, which is happening and which is impacting both directly and indirectly, because that is happening within the four walls of their houses. We also know that there is a lot of, because of cyber activities going on, the cyber bullying and cyber crimes and cyber stress because of various interactions which is happening in the cyber world is also impacting the youths in many ways. And of course, all the other panelists which we have said about this anxiety, depression, and the stress which is coming out because of this COVID, unpredictability of this COVID situation. The pandemic is something which is creating a lot of problems for everybody. So we all know that this, how do we handle with the stress? So I would straightforward go to this stress situation, and this fear of this current situation is because we do not know what is in store for the future. So looking at all those things and re-energizing our energy, which is already available within our body, is something which is very important. So we all know that if our mind is stressed, if our body will be stressed, and body will have all those different symptoms which will come in, which may not be physical, but it is psychological, but the presentation are various physical. It can be presented as headaches, it can present as chest pain, or even GI abdominal symptoms. There are a lot of symptoms which we know are psychogenic, and we also know it reduces the immune system, because there is a concept which is very now popular, that is called the psycho-neuro immunology, psychoneuroimmunology, because there is a connection between the psychology, neurology, and the immunology, that is the immune systems in our body. So we know that our psyche, or the brain, how we are stressed out, or we are relaxed, will help in changing our neurophysiology or various neurotransmitters or the hormonal systems in our body, which in terms changes our immune systems. So if we can work in this trilogy of psychoneuroimmunology, is something which is very important. And how do we do that? Because stress management is something which is very difficult, and at the same time quite easy. But because we have to understand the brain, because there is a difference between what is brain and mind. Brain is a structural component, and the mind is a functional component of the brain. So in the brain, I would like to elaborate something so that we go forward before that. There is a concept of conscious and the subconscious mind. The subconscious mind, the conscious mind is what is a logical mind, which we all work upon. And the 10%, less than 10% is a conscious mind, and the more than 90% is a subconscious mind. But more than 95% of our decisions are based on the frames which has already been defined and designed, and the experiences which has already been there within our subconscious mind, and we act accordingly. So the subconscious mind is the one which, if we retrain them, subconscious mind, if we reprogram our subconscious mind, we can change our conscious activities which we are doing consciously. So the subconscious mind is something which is very important. And how do we retrain our brain is something which I am working on, and I have been working in various capacities with different people, and it has brought in a lot of success rates with the young people, with even the aged people. In the Alzheimer's people, we know that the brain reprogramming works very well. So we have to understand that, as Mr. Dr. Mehdi was telling about the let go principle. Yes, it's a very important let go principle, because we have to understand that we have to leave the present, because past is already gone. We cannot rely on the past, and the future is unknown. So what is left out is a present. If we can strengthen our present, then the future is automatically becomes easier and strengthened. I am giving a very easy chronological example, which used to be there in long term. Previously, in the corporates, there used to be a quality management department. What the role was? Well, the role was to see the product was of a quality or not. Later on, it was understood that if you may see that the product is quality of a quality or not, based on not on the what the product is, but based on the process. If we can strengthen the quality processes, all the steps of our quality are maintained at the time of processes, then automatically the result will be of quality. So instead of focusing on the results, if we focus on the processes, then the quality is maintained. So this stress management is something which is very important. So if we can bring that let go principle, because we all know this story that if we try to fly the kite against the wind, it will never fly. So it is always that we go with the wind. The go with the wind is something which has to be learned, which has to be taught to the people. Similarly, I'm giving a very simple example of swimming. When we try to learn swimming, we try to make ourselves rigid. And when our body is rigid, the body, instead of floating, goes down. And once we let go our body, once we leave it to the water, that let my body be floating, and automatically we start floating. So when we let go, this principle has been understood. We understand that we have to be strengthening our present. The automatically our future will become much more easier, and we can deal with the stress much easily. But another important thing is that how do we train our subconscious mind? The subconscious mind is based on this concept of affirmative actions. So these affirmative actions, because the negativity and positivity changes our hormonal system, it changes our neurotransmitters, and there are a lot of studies which have shown that the affirmative actions, if you do, there are affirmative centers within the brain, in the cerebral cortex, and it also changes some hippocampus and amygdala. These are centers within the brain which changes the parasympathetic and sympathetic nervous systems. So if we bring in that affirmative actions, if we start counting our blessings, automatically the changes will happen, and we will start to understand the positiveness. Instead of being, it will make us better. If you start positive thoughts, it will prevent us from being bitter. Because if you are better, obviously the hormonal changes will happen, and it will help in improving our systems. So what do we do is that we always say that we have to change our attitude towards life, because something which is there, we cannot change it, but we have to identify what is positive which is happening. One of the positives is that today we are connected to this webinar, and I think I have been learning much more than what I was learning from different conferences before this webinar concept started. Now we are able to connect with the different doctors, different experts across the world, as sitting at our home. So every adversity has got some opportunity. So we have to see how there is a green patches in the sand rather than the sand in the green patches. So looking at those concepts is very important. And the most important thing, that in the subconscious mind, if we regularly feed these affirmative actions, the affirmative thoughts, we have three concepts. One is a thought, one is the feelings, and then one is the actions. So if we can change our thoughts towards the positivity, then the feelings will automatically becomes more and more emotional, will be more positive, and the actions will become more affirmative. So these affirmative centers will get activated. Another important is that how do we do that, and how do we train our subconscious mind or reprogram our subconscious mind? Yes, somebody told about the meditation. Now the Western psychology and the Eastern philosophies are coming together. The concept of mind, body, and energy are coming together. The energy which was already there within the Eastern philosophy of your energy field with the cosmos energy field, the spiritual energy field, which is a universal energy field. If we connect these these dots, obviously our body will become better. Our overall immune systems will become better. And the most easiest technique which the Eastern philosophy has given, and now the Western psychology is understanding, is that of Omkar. We all teach our children the concept of Omkar, because it's a very simple technique of expiration, very simple technique. When we are breathing out, we use the word Om, and the Om has got two words there. It has got three actually words, A, U, and M. And when we pronounce the Om, we have either we pronounce O as a longer term and M as a shorter term. And it has been studied, there are a lot of studies in various journals have come in, is that if we use the word O for a longer term, it has got a physical well-being, physical health improvement. And if we use the M as for a longer term, Om, and then Om, so M is for a longer term, it has got a mental well-being. So it increases memory, it increases learning. And we always tell our children that if when you do this Omkar for 5 minutes every day for 2 times a day, it helps in improving a spatial memory. And there are a lot of studies that has been done in that. And when we do that by using M for a longer expiration with the M and a longer term, it helps in increasing the memory, and it helps in increasing the learning, and also calms down our overall stress and reduces the stress, and improves the overall well-being, because the parasympathetic nervous system gets activated and sympathetic nervous system gets reduced. So heart rate gets reduced, your anxiety gets reduced. So this is one aspect. I would always say that every people, irrespective of young or the old, should do this practice of Omkar every day for 5 minutes for twice in a day. The second important, which helps in improving the connectivity of this conscious and subconscious mind, because we have very limited time, so I am not practicing or presenting all those facts, but very simple, is breathing awareness. What is this breathing awareness? And the progressive muscle relaxation. These are the two techniques which is the amalgamation of the Eastern philosophy and the Western psychology. This amalgamation is closing your eyes and observing your breath. When you observe your breath, just observe, nothing to do, neither do you take a deep breath or something like that. You just observe closing your eyes, how the breathing is going on, what changes, or the movement of your body. You are just observing the movement of your body. Your subconscious mind gets connected to the conscious mind, and in the subconscious mind gets relaxed, obviously your conscious mind gets relaxed. And if you do this relaxation technique, of relaxing, and then you give a suggestion, the power of suggestion, which I was talking about, affirmative actions, the power of suggestion, that your body is getting relaxed, you are getting stress free, you are getting anxiety free, so your body starts relaxing. And it is a very old saying that in a relaxed body, a tensed mind cannot exist. So if our body is relaxed completely, our mind can never be tensed, and this will relax our mind. And once our mind gets relaxed, the anxiety areas, because some muscles has got a capacity to increase the anxiety areas, like the forehead, like the neck muscles, like the shoulder muscles, and sometimes during the chest pains. So these are the anxiety areas, because a lot of lactic acid gets accumulated in that space. And if we do these basic techniques of three important techniques, I would always suggest to all our people, including you, especially youths, that do this Omkar for 5 minutes every day, for morning and evening. It will improve the insomnia, reduce the insomnia, and improve the sleeping pattern. If you do this closing of your eyes and do the breathing awareness at the same time, do a progressive muscle relaxation of your body. The body is getting relaxed from toe to head, and do it for 15 minutes a day. It's amalgamation of it's a meditation, but I'm just sitting at any posture or any position and observing your breath, just observing your breath by closing your eyes. Your subconscious mind gets activated, and your conscious mind becomes relaxed. So if we can do these three things in a one go, I think our mind-body relaxation technique will help in healing a lot of our problems without doing any specific psychotherapy. But of course, if required, the psychotherapy and hypnotherapy, because hypnotherapy is nothing but a concept of activating your subconscious mind, helps in relieving a lot of stresses. A few days back, I had a patient who had a severe headache of a chronic migraine. And at the dead of the night, there was no one to treat her, because she called me up at the night. She had no medicines. I just gave her 10 minutes of breathing awareness and progressive muscle relaxation. And in this 10 minutes, that too online. And after 10 minutes, she said that her migraine has gone. And her migraine was gone for that whole night. And later on, she brought in some medicines. And later on, when the migraine again came in, she took that medicines. But I'm saying, see, the power of suggestion, the power of our subconscious mind is so strong. We can change anything what we want. So it is within us that we can change ourselves. So that is why I always say that we generally use the word best of luck. When we say best of luck, actually what we are saying is that someone else is responsible for my success. So we are becoming more of a effect person. That is, someone else responsible, someone else's fault, someone else is blaming somebody. So if we blame is an effect person, or if we take the responsibility within ourselves, there's a cause person, there's a cause and effect relationship, and we take the responsibility. So then when we take the responsibility, we do not say best of luck, we say do your best. Because if you do your best, the best will automatically come out of you. So I will always say that do your best, and I hope everybody does these 3 basic techniques. And there are different other techniques, different other therapies which we do, but at least these 3 techniques can solve 70% of our anxiety, stress, and depressions, and will bring a lot of change in our mind and body, and will help in reducing the mind and body healing. Thank you very much.
Thank you very much, Dr. Das. In such a short time, you could cover so many really important, doable, practical tips, which I think everyone will be very, very benefit and will be able to apply. I myself think I'll be able to apply that in my life. And even in the chat box, I saw Ms. Ravneet, she was saying an amazing explanation. So really, I think very, very useful tips from you. Thank you so much for that. Yeah. Moving on to our next speaker, who's been working with a lot of healthcare companies and all, we have Mr. Paul. And Mr. Paul, you've been interacting and you've been engaging with a lot of doctors, which also include psychiatrists, and you've been doing a lot of sessions with them. So could you please tell us in terms of what kind of messages are being done? How are you engaging with psychiatrists, and also not just the messages on mental health of people, but also about the importance of nutrition in these times. If you could just share something about that, it'll be really helpful. Thank you.
Yeah, first of all, thank you for inviting me in this session for a discussion on COVID. So yeah, a lot of stalwart neuropsychiatrists are there. They have shared their knowledge, how to uh, engage our mind to make our mental health better to fight against COVID. So we need to understand one thing, that mind, sleep, and diet, both all these 3 things are very cardinal and very important to fight against COVID. So first of all, anxiety. So we need to understand what is anxiety. So anxiety is quite normal. It's very normal and not dangerous at this prevailing situation. This is very normal that you'll be thinking of certain uncertainty. And when this anxiety becomes in excess, then you have got a problem. Say, for example, if I think that I might get infected, okay, that's a fear. So that will lead to do some good things so that I can fight against COVID. But if at every moment I think about COVID, so that might lead to depression, and then I might be requiring a neuropsychiatrist or a psychologist. So excess of anxiety, which leads to disruption of our day-to-day life, that is a problem. So at the same time, we need to understand that we are going through a very uncertain period, and we need to accept this uncertainty. Once we accept this uncertainty, we'll be comfortable with the prevailing situation. Like, we need that for the entire day, a basic structure for the entire day we have to do. We have to do it, we have to make it very simple, like waking up in the morning, have a shower, have a good diet for the entire day, and going to bed on time. So, and in between, relaxation, that is refueling the tank, that is relaxation is also very much important, like doing exercise like yoga, mindfulness. This not only relaxes our mind, but at the same time it boosts our immunity also. And we need to add few new things in our life which occasionally we never did, like doing some household chores. And these are the few things which, and also we should engage ourselves in some hobbies like painting, singing, anything under the sun which you like to do, which will engage in your quality time. So these are the things which will relax your mind. Another point is that we human beings are social animals. So always we want that we have to be, we want, always we want to remain connected with other people. I mean, the near and dear ones, friends, family, people, families. But physical meeting is absolutely no no now. No hugging, no touching. So we need to keep ourselves connected with our near and dear ones over telephone, texting them, WhatsApping them, and at the same time, we can do some act of kindness. And we should remain connected with people who actually wants your support. So all this actually gives you a lot of satisfaction from within. And when there is a lot of satisfaction, we secrete a lot of oxytocin. It's a happy hormone, also called love hormone. And when we are stressed, we secrete a lot of corticosteroid, which is stress hormone. So it's always better to secrete oxytocin, which will keep ourselves healthy and energetic all the time. And so this is all about connection. But at the same time, we need to understand that we have to disconnect with few things. See, our mind is an association machine. And once something get associated with our mind, it's really, really hard to disassociate that thing from our mind. So it's ideal that we should cut all, not all the information. So every day tons of informations we are getting with the advent of technology from different sources. So we need to cut down the lot of those informations related to COVID, which is not required actually. And I've seen many people googling about the images of COVID. So they land up with a lot of scary images. So those scary images get associated with our mind, and that disassociation is also very hard. So we need to engage our whole day not only with our activities but with these energetic activities like connections with the dear near and dear ones. And at the same time, we should disconnect ourselves from unnecessary uh, news about COVID. Rather, we should be aware about COVID from the news bulletins which comes from the ICMR, WHO, okay, and other public health organizations. So, mind is very important, plays a very important role in fighting against any disorders like here in pandemic like COVID. And next point is sleep. Sleep is very important, 6 to 10 hours sleep. So if you have got a sleep period from 10 p.m. in the night until 6 a.m. in the morning, please stick to that. So everybody, every individual has his own sleep period. So 7 to 8 hours of sleep is very important. You should stick to that. And see, now we are in a lockdown situations. We are working, most of us are working from our home. So whenever we feel sleepy, we are going to a nap. We'd like to have some nap. That's a very bad habit. So nap trap actually diminishes the urge to sleep at night. So rather, we'll consolidate our sleep for the night. Even at night, if you feel that you have gone to bed but after 15-20 minutes also you're not uh, getting the sleep. So leave your bed, go to the quiet corner of the room, and read a book, whatever you like. And whenever you feel sleepy, come to bed and have your good sleep. So mind, sleep, these are very, very important points to be, and how to get it engaged are very important. And at the same time, uh, diet is very important. So we got a lot of very good information from eminent nutritionists. So what the nutritionists are saying that we should be having proper diet. Proper diet means it should be having protein, carbohydrates, and fats in our diet, and every portion. So we should divide our diet meals in such a way for the entire day in 5 to 6 servings. Okay, so in each serving we should be aware that we should have a small portion of protein. So protein is something like that. It boosts the immunity apart from its other functions. So protein is very important in every meal. We should be having a portion of protein. We should always add now vitamin C is very vital. Vitamin C, zinc. So vitamin C we get some our sources like oranges, lemon, amla, rich source of vitamin C that has to be there in our food, and zinc has to be added. So, and at the same time, as because we are doing our jobs from work, we are doing our jobs from home, so we always love to have some tea and coffee. So to keep our respiratory tract warm, we should be having warm water or nice tea, might be green tea or normal tea. And also, you who are coffee lovers can have coffee. But one thing we need to understand about coffee: coffee has got good amount of caffeine, and this caffeine stays in our bloodstream for 8 to 10 hours. So ideally, coffee should be taken within 3 to 4 p.m. max, ideally, or else that caffeine will remain for 8 to 10 hours. So you might not be having that amount of sleep in the that urge of sleep might get diminished at night. So ideally, up till 4 p.m. you can have your black tea or milk coffee. Sorry, black coffee or milk coffee as you like. And at the same time, uh, this balanced diet should be something like that every day you should be having, for not only for yourself but every family member should be having this balanced diet. So having said that, you should be adding a lot of vegetables into it, seasonal fruits, nothing very expensive you have to go for. So protein, rich protein source, we know fish, meat, eggs. For the vegans, actually pulses, cereals, and rajma. These are all good sources of protein. So have simple diet which is easily digestible, and this is an opportunity for all of you to be there with your family members. Enjoy the every moment with your family, and at the same time do your job. This pandemic will never last for a longer period. Anyway, we don't know we are all uncertain about the date when this will end up, but this a time will come, this will end up, and literally internally will be so much strengthened enough that we'll find ourselves so much strong enough that we'll fight anything whichever will come in our life after this pandemic is over. Thank you very much.
Thank you very much, Mr. Raja, for touching on both the points really well in terms of mental health and how we need to deal with anxiety and ensure that anxiety doesn't increase, and also the importance of nutrition in both boosting our immunity as well as getting good sleep, how to be aware of the impact of caffeine and therefore avoiding such caffeine foods, drinks later at the night or evening. So I think again, great tips from you. Thank you very much. Moving to our next speaker, and I can see that there are already some raised hand and questions. So to all those who are listening to or tuned into this session, there's a message in the type box also, in the chat box, that we have still 2 more speakers, and post that we will be taking questions. So you can raise hands or type your questions, and we will be coming to question answer post that. So for now, we'll move to the next speaker, Mr. Chakravarti. Mr. Amrish Chakravarti, if I could request you to talk about, because you have an expertise in music and yoga, and so how can we really use music therapy, especially in terms of addressing such trauma situations, or dealing with stress? How can music therapy play a role? And if you could especially talk about how can we use this therapy for differently able people or special children, how can we do that? So over to you, Mr. Chakravarti. Looking forward to hear.
Mr. Chakravarti, are you there?
Yeah, I can see him. He's a co-host also. I don't know.
So please unmute yourself.
Okay.
Great.
Sorry, my this thing was under mute. Hello, friends. Firstly, I would like to extend my thanks to Shri Rajiv Mukherjee and Rini Mukherjee for organizing this talk show at this time of pandemic, and of course for the pandemic. If we talk professionally, music therapy is an evidence-based clinical use musical intervention to improve clients' quality of life. Music therapists use music and its many facets like physical, emotional, mental, social, aesthetic, and spiritual. Music in active and receptive music experience. These of course include improvisation, recreation, composition, receptive methods, and discussion of music. Uh, Evidence suggests that music therapy is beneficial for all individuals, both physically and mentally. Benefits also include improved heart rates, reduced anxiety, stimulation of the brain, and improved learning. The choice of music is carefully selected based on their music preferences. This is very important. And it must reflect the age and attention abilities of the child or others. At this time of pandemic, the school children's, they are having a worse time. But at our school in Lee Rhythm of Music, we have about 180 to 200 students in the stream of vocal music, instrumental dance of different forms, martial art, fine arts. There are 20 to 22 teachers to train them and teach. We also have a number of special children. The students are provided with training and a similar kind of facility given to the other students even. Even underprivileged students are given training. To cope up with the present situation of lockdown, apart from running regular online classes, we also have organized online performance-based programs by the students and the teacher, and special music sessions to encourage the students. At this time of acute pandemic, lockdown, we are stuck at home with our families for the past so many days, with no outings, no films, no shopping, etc. But out of all, children are facing a acute, difficult time and a very difficult period. With no outside activity, schools are shut, outdoor games. They had to force themselves to, in a way, house arrest. Their physical energy is suppressed without activity. In fact, physical activity and communication with the friends at playgrounds. The freedom in movement is restricted. This kind of a change in lifestyle has put them to a kind of a stress and depression. And this is the time when we must reach them at a very personal level. The kind of music they like. We have to identify the genre. It is very important. Identifying the music they are fond of. It could be a rhyme, a lullaby, a classic piece, a Bollywood song, a family song. It can be a particular sound of an instrument, say a sound of a piano, guitar, or a flute. These are all melody instruments. The other side is the rhythm. We all have rhythm in us, in talking, walking, while doing some work. We have rhythm. In fact, rhythm is there in our body since birth. Our heartbeat, that is the biggest source of rhythm. It is a constant process. Thus, we tend to pick up the rhythm very quickly, very fast. And it is the easiest, in fact, thing to pick up. If someone has shown them a rhythm, uh, like a parent has to help them in this manner. If you have a small child at home, ask him to get two pieces, uh, two plates, you can say, of different sound, and strike one of them and count one. Then two, strike one on the left, and other one on the right, two different sounds. Similarly, go to 3, 4, strike so many times, and let the child copy this. This is a very common and very fast picking activity a child will do. The enjoyment comes out of it and a kind of learning. The child tends to follow you. A kind of a training is imparted to him. So these are the things. The other day, one of my friends called up and said, I do breathing exercise by singing. The whole day I keep on singing my favorite songs, and that gives a very good exercise as far as breathing is concerned. I said, absolutely fine. This is one way of it. So identifying the kind of music, the instrument sound, the genre, it could be a devotional song, a ghazal, a Tagore song, anything. But the liking of that music has to be there. That the parent has to work on it and help the child. Rest, I think my other friend Anuruddh Chaudhary, he will follow and give you some advice.
Sure. Thank you so much, Mr. Chakravarti, for talking about how music can have an influence in terms of decreasing the anxiety amongst people. So moving to Mr. Chaudhary now, Mr. Anirudh Chaudhary, I would like to specially understand from you, not just about COVID, but we know that in India with monsoons arriving in the entire North India, in Bihar, Assam, already floods have started and there is a flood and disaster season that we will be seeing. So whenever we are faced with such, such events where disasters and stress take place, how can music and yoga and music therapy really, what role can this play? And also if you could talk about how can we use this therapy for different sections of the society, for different groups of the society, for different age groups and different children, special children, all. So if you could talk about that, please.
Yeah, thank you, ma'am. First of all, thanks to Spear India and Lee Rhythm School of Music. Thanks to Rajiv Mukherjee and Rini Mukherjee for inviting me. And the first thing, as we are doing it, we are calling it music therapy. So music itself is a therapy from my point of view. Music is called a stress buster. And the thing is, one of the point Dr. Mehdi said, when we move to our third phase, it's anxiety, it's mental disorder, problem of depression and all. He has taken that point. And one thing I like, Dr. Kalyan had said that we have to do Omkar. Om. Om is the basic nad, what we call nad, music. Nad means sound. Om is the thing what we have been having from the ancient times. Still it is there and it will be there. So Om, when we keep on repeating it, it releases the stress a lot. And it's not only music. And as you said, flood situations and all of the depression is always with any normal person. Any type of depressions are there. COVID situation is one of the situation. Flood, lot of people are having financial problems and all, owing to COVID situations, flood, and other problematic scenarios. But depression is there. So how to relieve it? Music. Uh, Nowadays, you must have seen every, even if he's a singer or not, if he's a musician or not, everyone is producing a video and uploading in YouTube or FB for everybody to see, so that he gets his enjoyment. He knows, okay, I'm satisfied, I'm not depressed, I'm doing it for the, when others see, they see their talent. अरे ये तो पता ही नहीं था इसने ये गाता भी है. So this phrase also comes. He can dance. We didn't know that. So in this situation, in this lockdown situation, we are experiencing these sort of things, that many people are coming forward and expressing their talents or showcasing their talents, which many doctors are doing it. And hats off to all the doctors here present. They are doing a lot of great job for our society. And so I'm really grateful and thankful to them. And along with that, many doctors have become singers, as in one of the cases in Chile, sisters were playing violin to help the COVID patients. Sisters were playing violin So these things come up when they are these music as a therapy. If you go into definition, then music therapy are of two types. One is active therapy, where you are making one to play, and one is receptive therapy. Receptive is when you want others to listen. It may be a live performance, it may be a recorded performance. Many so these these two type of therapies work all together to relieve your anxiety, depression. Many patients, music is being used as reiki as well. In YouTube you can see many relaxing music. In Tibetan culture, they use these bowls, these vibrate these sounds, and make this om chanting and all, just to release their tension, release their pressure, release their anxiety, release their depression. These uh, these things, when drums, flute, chimes, bells, these are some of the mainly instrument. I'm basic from instrumental background. So I'm telling these are the soft instruments which releases our blood pressure, our heart rate. When we increase the volume, you have seen many of times we increase the volume, we increase the tempo or the speed. You can see, you can automatically note that your heartbeat is increasing, or your blood pressure gets increased. So to calm down, we use calm music, soft music. So listening is very important. Listening is a main part. Receptive therapy is more useful. In receptive therapy is so much useful that it helps you a lot in listening and diluting uh, your bloodstream. It helps you a lot in other song activities. Songs are there, instrumental is there, songs, various genres are there. As Amresh recently told, ghazals and all. These are soft numbers which helps in us in sleeping disorder, as Mr. Paul has also said. Sleeping is a thing. Nutrients point of view are there. So everything uh, is is correlated. Music, it's not only music, it's also yoga, it's also meditation. And like Lee Rhythm School has been organizing these online classes for the children. The main worst, I think the criteria and main worst are going, uh, are having, are deprived our children in this situation. They can't go out, they can't move around, and online academic classes are going on. Online academic classes are going on. So this is creating a burden, extra burden for them. Every time you have to keep on relaxing their mind. Their parents keep on shouting. So I think online classes are there. Fine, online classes are going on, but the thing is, I would encourage the parents to also join the children, to come forward and sit with them. They can also learn, they can also sit with them. The children can also learn the music. Like Lee Rhythm has been organizing various shows. Like I've last year there was a show where the children gain confidence by playing, sharing platform with Shivmani ji was there. So it's a great boost and encouragement for them. Great boost and encouragement for them, that like other big shot music personalities are there, who can come forward and share platform with them. It makes them happy. It gives them so much confidence that they can do anything. Earlier, some children were not being able to sit for just 5 minutes. Now after learning and getting accustomed to staying at home, they are doing it for 1 hour. so this stage of platform and encouragement keeps them revived. And then one of the things I would say, that these mental balance and anxiety, everything gets a relaxation from music. And I think some research also says that endorphins are released when you listen to music. Doctors may agree, may not agree, but I've heard that researchers have said endorphins eases your pain. It eases your pain, so it helps. And now, so if the music helps in all the way, everyone should go for music. Maybe it art pursuit, maybe it art, maybe it dance. Music is conglomeration of dance, instrumental, vocal, and dance, everything. So when all the art pursuits are there together, you can utilize the art pursuits along with yoga, meditation, martial arts. Martial arts is one of the factor where you can have your physical uh, strengthen. So mentally, physically, both has to be strengthened at this time of hour. So you have to uh, go by it. Therapy is just a point of view to relax. I'm I'm not a trained therapist. That's the work of a music therapist, how they do it. But this is the basic structure where you can help singing, listening, playing, and easing your mind out to make your anxiety, depression calm down in every way. Like Lee Rhythm has been organizing all these online classes, and all children are being supported. I would encourage all the parents to also come forward and sit with them. They will also enjoy. They will also get relaxation through it. Thank you, ma'am.
Thank you very much, Mr. Anirudh, for making us realize the power of music. We all have music as a part of our life, but sometimes we don't really understand that how we can make use of it as a stress buster, how we can use the music, the soothing music for relaxing compared to the music with rock kind of music, which can actually increase our heartbeats. So that's great to know. We have slightly less than 10 minutes and we have questions in the chat box already. So I'll start with the questions now before I say formally thank you to everyone. So one of the questions that we have is for Dr. Kalyanashish Das. This question is from Ms. Archana from Orissa. She's asking that is anxiety a hereditary disorder? Dr. Das, can you talk about that?
It's a good question. I have seen all those questions in the chat box. And thanks to everybody for appreciating my talk in some way. Of course, anxiety, when we say hereditary, anxiety is an acquired disorder. Anxiety is an acquired disorder because when you have been seeing your parents, your family members around from your birth as anxious on various, it goes into your subconscious mind. It gets into your programming. It becomes one of your part of your own system. And then gradually, when those situations comes in a similar situation comes in your life, you start acting the same way you have seen in your whole life. So it is a reprogrammed structure which is there in your subconscious mind, which gets activated whenever such situation comes. Your conscious mind starts working accordingly. So it is an acquired phenomena, but it is acquired from your birth or even before your birth, from your womb. So if we see it as a hereditary, but it is not hereditary in that sense. So if we can practice to understand our anxiety, the causes of our anxiety, understand our subconscious mind, retrain our subconscious mind, reprogram our brain, and obviously we can get rid of anxiety, because we have seen a lot of phobias being treated. We have seen a lot of obsessive compulsive disorders being treated just by retraining our brain and reprogramming our subconscious mind. So it is about the subconscious mind which will actually change our entire attitude towards life. Another important question I think somebody has asked about the Om being practiced in West. So yes, What I was talking about or research, because I am a logical person, having being a medical person, I never understood all those things. Gradually, I am understanding. Still, is a student of Eastern and Western philosophy to amalgamation of Eastern Western philosophy. And what I am talking about are all those studies and researches which has been published in different journals across, and where they have studied the EEG patterns and the brain and spatial memory results after different sessions which has happened with this Omkar with different children across the world. But I do not know how many of the Western people are practicing Om in that sense. But the studies have shown that yes, and the Western studies have shown that Omkar really changes your spatial memory and increases concentration for the children. So if we really want our children to increase their concentration and memory, we should definitely go for this Omkar with M, with the more focus on M, because M has got this mental strength to increase, and memory changes happens because of that.
Sure. Thank you very much. We have a question from Ms. Samima Parveen. She's asking, how can we develop a positive attitude? Any of the speakers can respond. It's not focused on any one. So, Dr. Palash, would you like to respond to this? How can we develop a positive attitude? Dr. Palash, are you there?
Can I take that point, because it will be easy?
Yeah, sure, you can. I mean, any speaker, actually, it's open to all. Yeah, thanks.
Okay. It's a very important, pertinent point, that how do we change how do we develop positive attitude? The first and foremost thing which we have to do to develop the positive attitude is to study our own feelings and thoughts. Every day, if we can study our own feelings and thoughts, and we put it down in a piece of paper, because that's the first thing which any psychologist or a psychotherapist or for that matter psychiatrist does, is they put it down in a piece of paper. What is the feelings and thoughts which are coming into your mind for any purpose in your whole day? And you then analyze your thoughts. You're using a cognitive behavior therapy to with your own cognition, that whether these thoughts are positive or negative. And if you find that out of the 10 thoughts, 7 thoughts are coming which are negative, then definitely you have a negative perception within your mind. And then you try to reframe those sentences or those feelings, that is there any other way of looking at the same thing from a different perspective? Because every coin has two sides, and we can analyze our every actions and every things and perception in a two different ways. So can we make that change in our own words, the change these words which we have ourselves written, to change it to something which is positive? And the third important thing is that I said in my lecture, count your blessings. When we say this, count your blessings, please put down at least 3 positive things which has happened in your whole day, which has made you happy, which has made you to smile, and keep that paper, read it over and sleep it over. When you read it over and sleep it over, your subconscious mind starts activated through these positive affirmative actions, and these affirmative actions bring in these changes. And gradually, if we practice it over a period of time, because it is called a Pavlov's conditioning reflex. I'm talking very, very technically for that purpose, to make people that I am not talking illogical things. So what I am talking about is a very logical point of view, that if it becomes a conditioned reflex to talk positively. When we develop this conditioned reflex on a longer period of time, it generally takes 6 weeks to 8 weeks. Definitely, our positive attitude will start developing in and we will change ourselves for that purpose.
Great. Thank you, Dr. Das. We have a question from Professor Sangeeta. It's for Mr. Anirudh Chaudhary. Professor Sangeeta is asking if you could please focus on the fact that when we are in intense anxiety, can we concentrate on music at that time? Or rather, how can we concentrate on music if we are already out of our mind? So, Mr. Anirudh, if you could please respond to this.
Yeah. Hello. Yeah.
Yes.
The thing is, like intense anxiety. These are all situational or behavioral thing. Actually, anxiety, it can be intense or low bandwidth or something. But music actually, it's not that everybody starts singing in an anxiety situation or something. But that's a procedure when we want to make ourselves relaxed, and when we think we can calm down our anxiety, we can not even sing or something, listen to any form of music or anything to make ourselves calm or composed. It's very difficult. One of the time, I agree with Dr. Sangeeta that in in some situational matters, if it is very intense type of anxiety or something, then immediately you can't uh, run to a music and play a music and get yourself relaxed. It's not that, but it's a basic procedure when you want yourself to come to a relaxed position. You can use this therapy of music. Or Amresh can also add if he wants to add something.
Thank you, Mr. Anirudh. I think we've already reached the end of our session now. It's 6:30. We do have some more questions, but I don't know if within this time, for example, someone has requested if we could demonstrate breathing exercises. That may require more time. So I'm not sure if we'll be able to take it right away, but maybe we can get back with some explanation of how that can be done on email to them. Also, there's one more question of Mr. Sudhanshu uh, about if can COVID be transmitted by money or use of coins, and also it's more about the COVID particles remaining on the surfaces and how we clean the surface. Perhaps that can be taken separately. So for now, I'll take this opportunity to thank each one of you for this really useful and enlightening session. I personally learned a lot, and I'm really grateful to Dr. Medhi, Dr. Palash, Dr. Kalyanashish Das, Mr. Paul, Mr. Chakravarti, and Mr. Chaudhary, and for the amazing audience, listeners, and participants for great active chats. Thank you, everyone, and thanks to Navila for coordinating and facilitating this whole thing. So I'll hand over now to Navila for the final close. Thank you very much.
Julia, I would just like to do a last bit of announcement for all my audience here. Is my screen visible?
Yes, Navila.
So Sphere India also gives a certificate of participation to all the audience who participate and be a part of our session. So to get your certificate of participation for this particular discussion, you can visit our website, which is www.sphereindiacovid19academy.org, and your certificate will be ready to download after 24 hours. You can look for the course name and scroll down, enter the details, and you'll get your certificate. But it will be ready after 24 hours. Sometimes in the past, there are a few participants who have faced the technical glitch in downloading the certificate. For that, you can write to us at this email ID which is provided, which is covid19academy@sphereindia.org.in, and we will resolve the query for you if you're facing any kind of technical glitch or not able to download your certificate for any reason. So, with this, I would really like to thank all the panelists today for a very, very enriching and very innovative discussion. Thank you, Ilya, for moderating and keeping us all in time. Thank you, all the participants, for being here during this time. So, thank you, everyone. Have a great evening, and we'll meet soon in the next session.
Thank you.
Thank you.
Thank you.
Thank you very much.